Hi, this is Mrs. Lewicki, and this is the concept of collaboration. And this is part one of five PowerPoint sections discussing collaboration. And you can follow along in your textbook to help you with this. Concept of collaboration. Collaboration is when two or more people working toward a common goal by combining skills, knowledge, and resources while avoiding duplication of effort. Most of us have collaborated in our lifetimes. We collaborate nurse to nurse, we collaborate nurse to physical therapist, we collaborate parent to parent, parent to child when we're trying to accomplish a goal. The goal in the healthcare environment is to improve patient outcomes without duplicating the services that we're providing. The American Nurses Association recognizes collaboration as a key component of nursing practice, and Standard 10 is specific competencies related to the nurse's role in collaboration. The Quality and Safety Education for Nurses, or QSIN project, identified teamwork and collaboration as two of the 6 competencies needed to achieve high-quality patient care. And you'll notice that that is part of our student learning outcomes, as well as part of the learning outcomes for this course. It involves mutual respect and true sharing of power and control, which are essential. Sometimes when we're trying, and we'll talk more about this in conflict when we get to the conflict section, but a lot of times we struggle with who owns the right to do that. Because we can do it, are we necessarily the best person to be doing that for the patient? And ideally, it's a dynamic, interactive process in which patients work together with the healthcare providers to meet the health objectives. There's an increased emphasis in the nursing community on value of interprofessional collaboration and practice to improve patient outcomes. Interprofessional is professionals from various disciplines along with support staff, patient, and family members. And that's something that we really work on and is key to improve patient outcomes, is working with the other professionals. Successful collaboration requires that nurses develop skills in communication and teamwork, that they value roles, responsibilities of other team members, and work to establish a climate of mutual respect. Collaboration can occur between nurses, I said this earlier, between healthcare providers and patients, and between healthcare providers from different professional backgrounds. Collaboration levels will vary, and what we collaborate will vary depending on the professional or the role. Interprofessional teams recognize each individual profession's value and contribution to the well-being of the patient. Atmosphere of mutual trust and respect. And it works better if there's open discussion and shared decision making. And a lot of times you'll see in the hospital, and it depends on the hospital, but you will see interdisciplinary rounds where they're making rounds on the patients to discuss what the other roles are and how we are all helping the patient to meet their objective of getting better. Nurses may also be involved in collaboration to develop community initiatives, to write or revise legislation, and to conduct health-related research. And nurses must assume accountability and increased authority in practice areas, and that's those areas where it falls in our scope of practice. Concepts related to collaboration, so these concepts interweave with the concept of collaboration, and those are health policy and healthcare systems, and those we really explore further in the 4th semester. Professional behaviors, quality improvement, and safety, those were explored in the 1st semester, and they should be being carried out throughout. And so all of those relate to collaboration. And these are members of the team. I'm not going to read the list here for you, but the list is here. And when we discuss this, the concept of collaboration in person in a face-to-face meeting, we will do a little more work on what each of these team members, what their responsibility is. Competencies based to basic to collaboration, sorry. So competencies basic to collaboration include mutual respect, trust, competencies basic to collaboration include mutual respect, trust, effective communication skills, giving and receiving of feedback. So you'll remember some of those from first semesters when we talked about communication. Decision making, again, we talked about that in the first semester, and conflict management. And some of these we will explore further in further collaboration PowerPoints. And communication skills are vital for collaboration. Miscommunication is one of the most frequent root causes of sentinel events. When they're exploring why an event happened, it often points to miscommunication, whether it was fear or of clarification, fear of making that phone call, or just not understanding what the healthcare provider was asking. True collaboration requires skilled communication and mutual respect. Expert collaborators hold themselves and each other's accountable. Each member of the healthcare team should be sensitive to differences in communication styles, effects of own style on collaboration. So understand, if you do a better job at written communication than verbal communication, where your strength lies. And so if you fear that you didn't express your viewpoint well verbally, you need to make sure that you own up to that and try to improve that area where it's weaker. Team-centered communication includes appreciation for member contributions and everybody's voice is equal. Focuses on the we versus one-sided commands, and focuses on shared responsibilities. Effective communication occurs only if each team member commits to understanding what and appreciating what that other member is bringing to the table. And for patients, communication is a key component of effective nursing care. That ends part 1 of this presentation.